Let's go to Dr. John Puntis now, co-chair of the Keep Our NHS Public campaign. Good morning to you, Dr. John.
Hello, Matthew.
Happy Easter. First of all, let me start with this comment from the authors of the report in The Lancet, that in part, privatisation via the outsourcing of services to the private sector does not seem to deliver both better care and cheaper care. So why is our Health Secretary so keen on it?
Well, I think it's an ideological commitment, which is about shifting wealth from the poor to the rich, if you like, fostering private business and supporting that in a way that's not in the interest of patients. I think that comes down to ideology and, of course, a long history of not liking the NHS as a comprehensive public service, which goes back to before it was founded.
Indeed, after it was founded, I think Churchill was minded to try and do away with it, but found that public love for the NHS was so great that he realised he'd made a mistake. I do wonder that if you run a service down, public affection for it may diminish as well. Are you concerned that that's what we've been witnessing over the last 10 plus years?
Yes, I mean, I think that's the sort of classic paradigm with public services, isn't it? You know, you underfund them, they start to deteriorate, and then people say we need to have a change in system rather than saying we need to have more money. And I think the suggestion by Victoria Atkins is really a complete distraction from the underlying problems in the NHS, which you've already outlined. So the chronic understaffing and the chronic underfunding in relation to need and lack of efficiency in the NHS is a product of the whole system. So it's having fewer beds, it's the discharge logjam, social care in collapse, high staff sickness, more complex patients, necessary infection control measures post-COVID. And many of these are the product of Conservative policies in relation to trying to shift things to the private sector and, of course, underfunding the NHS.
Is a short-term win to be had? I mean, I'm just thinking, I know quite a few, because of my age now, I know quite a few people that are waiting for hips and knees and such like. I can't think of any of the ones I'm thinking of that would refuse to go private via the NHS. They want to be fixed and they don't really care how it's done. So whilst we are arguing for the great and the good about the NHS, about maintaining the quality of the NHS, if you were actually in need of service, of help, would Victoria Atkins' proposal help, John?
Well, she's using the same argument as Wes Streeting, of course, that the private sector sits there with spare capacity waiting to help us out. And it isn't really like that. I mean, just in COVID, the private sector were given $2 billion in order to support them. And they were, in return, supposed to do work for the NHS. And they actually did very little.
Yes.
They also took the opportunity to claim $72 million back in furlough. And the private sector... The private sector is quite small, about 8,000 beds. Where do their staff come from? They come from the NHS.
That's exactly it, John. I can understand. Thank you, by the way, Dr. John Puntis there from Keep Our NHS Public.